Everybody, thank you for coming. Today I have the distinct pleasure of talking about medical treatment for Parkinson's disease, and also I'd like to lay the foundation for deep brain stimulation surgery and how it's so beneficial for our patients. So I'm going to begin by showing a video. This is a patient with Parkinson's disease. As you can see, she has a lot of tremor, mostly affecting the left side of her body. Her tremor is affecting the left side of her body. She's very slow, even on the non-affected side, which is her right. And notice how she's so slow on the left. These are some of the tests we ask our patients to do when we examine them, the rapid alternating movements. Then we ask her to stand up, and as you can see, she has a lot of difficulty getting out of her chair. All these are very typical features of Parkinson's disease. Then we ask her to walk, take a few steps, and as you can tell, she has a very stooped posture, slow steps, and then she freezes. This is a phenomena that's very disabling to the patients, and at this point they're also very vulnerable to falling. She tries to negotiate a turn. She's still very slow, takes multiple small steps to turn. And then she's frozen again. We try to give her a lot of cues to unfreeze her, like to step over his foot, to show a cane with a laser light. And she stays in this frozen state for about 4 to 5 minutes. And then she's able to walk again. Next. So this is the life of this patient. As you can tell, it's very disabling. She has a very poor quality of life because of all these symptoms.
Is she on medication?
This is an off state, without medications. Yes, this is without. This is how we examine our patients. When they come to see us the first time, we ask them to come without medicine so we can see how much the Parkinson's is affecting them. And then we give them the medicines and we reevaluate them. We also rate their disease. So Parkinson's disease was first described in 1817 by a British physician by name James Parkinson. He wrote about it in an essay on the shaking palsy, and his description was very accurate. So what is Parkinson's disease? Parkinson's disease is an idiopathic disease. That means we do not know what really causes it. It's relentlessly progressive, and it's a neurodegenerative disorder, meaning that it's caused because of degeneration and dysfunction of the brain cells. It has 4 cardinal features. These are like the primary features of Parkinson's disease. There's a tremor. It's predominantly a resting tremor. That is when the hands are resting and you're not actively using them. Bradykinesia or slowness, rigidity or stiffness, and postural instability, which also means poor balance. There are many other signs and symptoms of Parkinson's. Patients have a stooped posture and a shuffling gait. They have decreased arm swing when they're walking, which is decreased on the side that's more affected. They have difficulty arising from a chair. They have micrographia, meaning small handwriting. They have decreased facial expression, difficulty turning in bed, a diminished sense of smell. Now, this is a very early feature. Sometimes it can precede those motor features by more than 20 years or so. It's one of the earliest signs that patients notice. They also have a low voice volume. They can get painful foot cramps or dystonia. This is more common early in the morning when they're off their medicines. Patients with Parkinson's have many sleep problems. They have difficulty falling asleep, staying asleep, and also they can have a lot of sleepiness during the daytime. Anxiety and depression are very common. So is constipation. Patients with Parkinson's also have drooling or sialuria. This is not because of increased production of saliva, but because of decreased swallowing ability. They can have urinary frequency, urgency, and erectile dysfunction. Just to go over a few numbers, Parkinson's disease is the second most common neurodegenerative disorder after Alzheimer's disease. About 1 million Americans are affected. The mean age of onset is about 55.5 years. Approximately 65,000 new cases are diagnosed each year in America. It's a very expensive disease. The direct health-related expenses, indirect disability expenses, and lost productivity amount to about $25 billion a year. The medicines are quite expensive as well, and they cost insurers and patients about $1,000 to $6,000 a year. How do you diagnose Parkinson's? There's no test or an exam that, there's no marker for Parkinson's disease. It's just a clinical exam. You need presence of at least 2 of the 4 features that I talked about before. That is the tremor. Okay. Do I need it? So you need at least 2 of the 4 features that we spoke about, the tremor, rigidity, slowness of movement, and poor balance. But you definitely need slowness to make the diagnosis. You also need an absence of other causes, like should not be on any medicines that can cause Parkinson's-like symptoms, and should not have multiple small strokes that can cause these features. There are many diseases that look like Parkinson's but are not really Parkinson's. Something like essential tremor. These patients, and then again, tremor is the most bothering complaint, but it's not a resting tremor. It's a tremor that comes on when they're using their hands to drink or to feed themselves. Another disease that can look like Parkinson's disease is progressive supranuclear palsy, called PSP. The way this differs from Parkinson's is that there's a very rapid onset of symptoms. So suddenly they'll notice that their symptoms are getting very worse very soon. And they also have difficulty looking down. Multiple system atrophy is another disorder that can look like Parkinson's disease. And in these people, they have very early onset of urinary problems and early falls. Vascular Parkinsonism, this is due to several strokes that you might have in a strategic area, and that gives you signs of Parkinson's. And poisoning by things like carbon monoxide, manganese, and pesticides can look like Parkinson's disease. So what's the main abnormality that causes Parkinson's? If we could just go to the next slide. Thank you. So if you look here, this is a cut section of the brain from a normal person, and this is a patient who has Parkinson's disease. So you can tell this black thing here is very less in this section. This is called the substantia nigra. What this does is it produces dopamine, which is a chemical that regulates movement. So if you look at this slide, you see there are lots of neurons and cells here, but here with the patient who has Parkinson's disease, these cells are missing. If you have up till 50% loss of these cells, symptoms of Parkinson's are still not manifest, but when you lose more than 70%, that's when some of these symptoms start emerging. Treatment options for Parkinson's, and this is like one of the main topics to be discussed today. There is no definite preventive treatment available. We have a lot of symptomatic treatments, which can be medicines and also surgery. There are other supplemental therapies that patients with Parkinson's need, like physical therapy, speech therapy, and occupational therapy. The others, restorative, they're all experimental only. There are things like transplantation, where they try to take embryonic and fetal cells and put them in the substantia nigra, but the results have not been very promising. These patients had lots of dyskinesias, extra movements, and did not do too well. Neurotrophic factors, these can also be introduced via surgery, but again, the results were not very promising from these studies, and a natural way of growing these neurotrophic factors. Now, these are factors that help to regrow the cells that produce dopamine. A natural way of doing that is by exercise.